Hello everyone. In this video, we are going to look at the difference between benign prostatic hyperplasia, that is BPH, and CA prostate. Let us straight away jump into the topic. BPH usually occurs in age greater than 50 years. CA prostate is also a disease of the old age, but usually we are seeing it over the age of 65 years. Pathologically, BPH is a benign, non-malignant growth in which we are seeing hyperplasia of the stromal and glandular elements of the gland, which means the number of cells are going to increase rather than the size of the cells. CA prostate is a malignant condition or it is a adenocarcinoma type of cancer originating in the glandular epithelium. Both the conditions occur insidiously or gradually progress from time to time. The symptoms in BPH are that of the lower urinary tract symptoms or LUTS symptom, in which the patient has irritative as well as obstructive symptoms due to the growth in the gland. These are associated with increased frequency, nocturia, hesitancy during maturation, weak stream, and a sense of incomplete emptying. The symptoms in CA prostate in the early stages are of mild obstructive variety, or usually the patient is asymptomatic in the initial stage. Pain is usually absent in BPH, and in CA prostate in the initial stage, like I said, there is no pain. However, as and how the disease progresses and becomes advanced, or there is a metastatic disease, the patient complains of pain. Hematuria is rare in BPH, whereas it is a common finding in CA prostate. On per rectal examination or digital rectal examination, we can palpate a uniformly enlarged, smooth, firm, and non-tender nodular gland in BPH, whereas in CA prostate, we can feel hard, nodular, irregular growth which may be fixed to the surrounding structures. PSA level, that is prostate specific antigen, is mildly elevated in BPH, whereas it is markedly elevated in CA prostate. Complications such as acute retention, urinary tract infection, bladder stones, hydronephrosis, as well as renal impairment can happen in BPH. In CA prostate, the complications such as bone metastasis, pathological fracture, urinary obstruction, as well as other symptoms of weight loss, cachexia, malnourishment happen in CA prostate. The treatment in BPH is both medical and surgical. On medical lines, the patient can be given beta blockers or the patient can be given 5 alpha reductase inhibitors as well as a combination of these two drugs. Patient can also be given surgical intervention in the form of open prostatectomy or the famous TURP surgery, which is transurethral resection of prostate. In CA prostate, the treatment depends on the stage and subjectivity of the patient. Surgery, radical resection of the prostate, adjuvant radiotherapy, androgen deprivation therapy, chemotherapy are the options for surgery. Just to revise, in BPH, we feel an enlarged, smooth, firm, and non-tender gland on digital rectal examination, whereas in CA prostate, we feel a hard, nodular, irregular, fixed swelling is palpated. BPH increases in the transitional zone in the middle of the gland, whereas CA prostate arises in the peripheral zone and progresses towards the center. Subscribe for more.